Hello, everybody. It's Dr. Troy here with Everything Disc. I'm excited you're tuned into our podcast today, our show. So I have a special guest with us today, Sheila Wenger from Gift Hypnosis. And I went to see her about a year ago. She's helped me with a lot of things. So I actually did a podcast with her a while back, and it was really fun. She actually motivated me to start doing podcasts. So I figured, well, why don't I invite her on the show? She's got a background in parent coaching. She's got a master's in education. She does hypnotherapy, counseling. So kind of cool. We always have good time together sessions and help me make some shifts in my life. So I'm like, hey, let's have a conversation. I know our subject's everything disc, but Sheila, why don't you tell us a little bit about your background, what you do, and then we can get into the meat and potatoes of our show today.
Okay, fantastic. Well, like you said, I have a master's in education and I coached volleyball and taught high school English and French for 17 years. And my passion in that area was always about motivation and how people get better at the things they want to get better at in their lives. And so eventually wanted to become a therapist and decided to make a career change. And on my path in school to become a marriage and family therapist, I had to study hypnosis as a part of that program. Having my background on psychology and human behavior and all that, when I, encountered that, I just thought that's a set of tools that is underrated. And so I then enrolled in hypnosis school at the same time. And when I completed that program, I just had a knowingness that I could help people a lot faster than I was helped through wonderful talk therapy. It was very good, but I just felt this knowing that with this set of tools, I could help people faster through their issues. And so I opened a practice immediately. And that was 3 years ago. And I was able to replace my pretty solid teacher salary after 7 years in my first year of opening only by word of mouth alone because of the results I was getting. So I've just been on fire ever since. I'm a little bit obsessed with my work and I love talking about it.
Yeah. Yeah. No, I remember I had some pretty serious health issues. We talked about that on your show with my heart and stuff. And I was like, I got to make a shift in how I'm living my life. So, you've really helped me with that. And I was thinking, because, some people go, oh, hypnotherapy doesn't work. But I'm like, it's just like anything. You got to keep working at it to uncover, I don't know, we call it layers of the onions.
Yeah. Yeah.
And I look at stuff that happened when I was a kid and I'm still living that pattern. And I'm like, now we become able to recognize it and say, okay, now I want to make the right change for a healthier body.
That's right.
So, our listeners tune in because, that we talk about everything disc. And I know we've kind of talked about this, but I kind of want to get your take on that, because you deal with people who are in emotional pain, but a lot of people suffer from spine pain or physical ailments. So is there any, like, a couple cases of maybe a couple clients that may have come to see you with, let's say, disc pain or back pain, and what did you do with them?
Okay. I'll address that and I'll also zoom out and speak about pain in general. I'll do both.
Yes, yes.
Yeah. When so there was one client that came to me for several issues and one of them was back pain. And so I did a very comprehensive way of working with her on that. But let's just take an example of chronic pain because of a disc issue. All right. Pain is a signal that we need to have signaling in our bodies to remind us that something is wrong, not do more damage and protect us. So there's a very good reason that we have pain. But there's also a deeper mechanism that we can tap into with hypnosis that can modify that signal. There are a couple things that I have to look for. So if there is nothing more that a person can do about their pain, right?
Yeah.
But the brain keeps signaling it and they already know what the issue is. The brain keeps signaling whether they need that signal or not, right? So one can go into the subconscious, which is the control center of 95% of our behavior and our thoughts and feelings, and our physical responses to those things. So what we can do, and I have done very successfully, is I will tap. There's two techniques I use that are very good. One is to tap into the deeper part of the person that has true dreams, aspirations, and things they came here to do as a human being. That is a very powerful part of themselves that can override something that's getting in the way of that if it's a
Mhm.
deep, heartfelt desire. And so when we align the person with that deep intent and then put this issue in its rightful place that is smaller than that, that will take over. And the subconscious will take in the message that this is an important part of why I'm alive. And anything that I can do about that to get the things that are blocking me out of the way, I will do.
Hmm.
Is that important to me? Then the whole system aligns and it's got coherence. It's all on the same page. And that
Hmm.
issue can take a smaller role if it still has to be there. So that's one thing I will do. And the other thing I'll do is a signal doesn't have to be pain. A signal is a signal. So I just did this successfully with phantom pain. This client, I just saw him last week. He had suffered phantom pain for his amputated leg 44 years. He's tried every drug. He tried Reiki. He's tried a lot of alternative therapies, and he happened to come see me. And so what I had him do is envision going to the back of his body, seeing the brain and visualizing the red part that's signaling this red pain signal. And that, reassuring the brain that if it needs to signal, it can signal. It just doesn't need to be red. Let's change it blue. Let's change it to a cool, pleasant feeling. A
Hmm.
pleasant feeling that reminds us that something's going on there, but there's no need for it to be pain.
Right,
It
right.
sounds it sounds really wild, but this man texted me that night. He had 44 years of unhealable, with all drugs, phantom pain, that he, in his case, that he could barely feel it
Wow. Yeah.
in one session. So those are two things I do, and it works for any kind of pain. But another gal that I worked on that had back pain, she came to me for several things. But in our session, when I finished the hypnosis, she literally comes out and she goes, "Oh my gosh, I don't feel my back at all." Oh, and I have one more. I completely forgot about this person. This is a friend of mine who lives in Chicago, and she was like this in our appointment. She's like, "I'm ready," because her back was all messed up.
Yeah.
And she said, yeah, so I worked on that with her. And after 3 sessions, she's upright like this. Now, this is the wild thing. I say to her, "How you doing?" And she starts telling me about how her relationship has improved. And I'm like, "That's wonderful." Then she tells me about how her annoying colleague that she could not stand. She literally says to me, "Oh, and also I feel totally better about Bethany, this colleague." I said, "You do?" She goes, "Yeah, I've decided I really appreciate her." I said, "You do?" And anyway, then she go and then I said, "I can't, help but notice that you're sitting upright." And she says to me, I kid you not, "Oh, yeah, my back's completely healed." Funny thing is she didn't even notice really that it was healed, or that was the primary thing she came to me from. Hypnosis sort of sneaks in and changes you, and you don't really realize it until you're like, "Wait a minute, that used to bother me, and now it's not." It's really quite something.
Well, I remember when I first came to you, my story. I was in AFib. I didn't know it for 2 years, and it led to heart failure. And so, I spent some time in the hospital, which I never want to do. But our first session with you, you're like, you can keep going down that path, which means, here's your funeral, or you could choose a different path. And I did. I chose that road, and it's amazing because everything just kind of starts lining up in the universe for that. So
Yes.
I can attest to that. And then I also, with your visualization you're talking about, I remember I was doing cardiac rehab, and I would stare at that heart rate monitor, and I wore a heart rate monitor all the time. I'd probably take my EKG 20 times a day, and I would study what normal rhythm looked like, and I'm like, that's what I want. And I just kept thinking in my brain, that's what I want. That's what I want. And then, after a year, I came out of AFib. I got normal heart function. Just everything's, the docs are like, okay, everything's clear. You don't need a pacemaker. You don't need ablation. You get off your meds. And I went, wow. So that shift of what's going on in our here with this monkey, you helped me. So that's why I wanted to get you on and talk about what you do, because so many people don't know, or they have a stigmatism about it, and they think it's just for smoking cessation. So what do you think are the top 3 things in your practice that people do, when they have some sort of pain, whether it's physical, mental, or chemical pain? What are the top 3 things they do on their own to self-medicate, which may be good temporarily, but long term, not good news for their health?
Yeah. What a lot of people do is just tolerate and then don't really pay attention to the damage that it's causing. So they, they'll just tolerate it, but they'll be grumping at everybody. They'll be, hard to live with, that kind of thing. And that is actually an unhealthy coping mechanism because they have this release, they're carrying the pain, the frustration, whatever. It's taking up energy and space
Yeah.
and they need a release, but they're doing that on their family members and causing a secondary problem. Another one is self-medicate, with things that also cause a secondary problem. People you drink too much, smoke weed or whatever. Those cause a secondary problem. They may relieve it temporarily, but they come with a second problem, which
Yeah.
isn't
And
great.
it could be pizza too. I mean, you were telling me there was a guy that was eating like 2 or 3 pizzas a day
Yeah.
and
Oh, yeah.
you got
Anything.
him off the pizza.
Yeah, oh yeah, absolutely. Anytime someone wants to cover up a feeling and they need to, I don't even judge them or blame them. They do something they need to because they don't address the actual issue or don't even know that they have another option, to address it. They don't think of hypnosis or they haven't thought of trying that or whatever. So then in the moment, they really do need to. I'm not blaming them.
Yeah.
But
Yeah.
if we just do that, we create a secondary problem and it doesn't take the first one away. So it's really valuable for people to think about, hey, is there something else I could do? And is it worth a try? The one other thing I'd say about that is with what I do, and I love this about what I do, people should notice a difference after session one. It may not solve the entire problem, but
Yeah.
it should show them that it's working so they don't have to be with me for 6 sessions and pay over $1,000 before they realize it's not, it's not working. Because they'll know in the first session if it's doing something. And 95% of the time it does. I've been doing this for 3 years and I work full time and I only remember 2 or 3 people that really didn't get something out of it. So it's not
Yeah,
much of a
I walked away from my first session. I was in a dark place, health wise. I'm like, man, I'm lucky to be alive. And I definitely remember that, like, okay, it's time to wake up and take care of yourself. Because I've been practicing for 30 years, taking care of people. I just forgot about me. And
so
so
easy.
that's one thing you helped me explore is like, hey, take care of yourself. And I see this a lot with people in my practice. The spouse will come in because they had a sick spouse and they've been taking care of them. They might have passed, and their health is just at the bottom of the barrel. And
Yeah,
so it's fun to see them come back to life. I know you can attest to that too. To see
100%.
people just come back, and you're like, wow, look at this. I got them alive again, if you will.
And you've been on that train ever since our first session. You have not stopped at all. I don't even remember who you were because you're not bad. I like you just got better though.
Yeah, yeah, me too. I think my family does too, so but
I'm sure.
so why do you think people stay in chronic pain, chronic pain patterns? Why do you think people are stuck on their pain patterns?
That's a really complicated question that has a lot of different kinds of answers, but I'll pick up on a few of the main ones. Sometimes it becomes existential. So, I mean, when something goes wrong, we all have different ways of dealing with it, and a lot of people feel like life doesn't like me. Bad things always happen to
Mhm.
me. And if that's been true, it's easier to just believe in that than to do anything
Right.
about it, right? And then they find, well, something can serve in every situation. If someone's a chronic victim, they often get other people to care for them and worry about them and do things for them. And then they just sort of get used to it and they think, well, that's I guess, how my life goes. But what's really happening is it's asking them to ask some existential questions and do some deeper diving and find the meaning of their life. But we all have the choice not to really do that and just sink. So that can be one reason. Another is they just don't know that this can help or other things can help, and they just aren't. That's just ignorance. They just don't know. And so they
Yeah.
need exposure like what you're doing right now. This is a great gift for people to realize, hey, there are other things you can try that you may not have tried. And when I first, like I said, encountered hypnosis in my therapy program, I hadn't thought about hypnosis as a path for myself at all. In fact, I even asked myself, people still doing that? I didn't really even know. But when I studied it, I was like, oh, this is with everything I knew about behavior, motivation, psychology, this is such a tool. And I knew that it had way more to offer than most people realize.
Yeah. And I've been studying some of these doctors who train like Olympic high performance athletes that win, triathlons and football games. And it's all just mindset and training your mind to overcome whatever challenge it is in a sport. And that, it's so cool because you can apply it to the average person's everyday life with the family and work and, trying to put
So
food on the table. Because we all get stuck in patterns, whether you're an elite athlete or an office worker. So
100%.
what are some of the ways that you help people break these bad habits or bad patterns? What are some of the methods you use?
Okay, I love that question. The pattern is not their fault. It lives in their subconscious and it got there for a reason. So they don't know that. They think something's wrong with them and they just can't, they just not disciplined enough and they beating themselves up, all this time. And when the truth is, our subconscious protects us from what we couldn't handle in our lives. So when we feel like we can never get past this barrier, it's kind of true because it lives in our subconscious. And unless we get to that level, always going to be managing it to try to jump over the hurdle. And it's a whole bunch of hard work. The thing that really works is it lives in the subconscious. You have to directly go in there and heal the pattern. So, for example, I had a 30-minute break at a professional conference, and this woman had seen this dog and grabbed onto me because she was afraid of dogs. I said, "Where'd
Mm,
that come from?" She said, "Well, I was like 4, and this German Shepherd just came up and put its arms on me. It didn't bite me or anything, but it just scared me to death, and I've
yeah,
been scared ever since." That's because the subconscious wants to protect her from that happening again when she's 4, and it makes sure it does. So now she's afraid of dogs while she was 67.
wow,
And
long
she's still
time.
afraid of dogs. So I took my half an hour. I said, I can probably help you with that since it came from one incident. And I went into her subconscious with hypnosis. I convinced 4-year-old her that where this lives, that she's all grown up now. Little 4-year-old you never has to be afraid of this. 67-year-old is going to take care of it. She's going to make sure that if a dog feels in any way unsafe, she's going to take you away. But if there's a sweet, cuddly, furry, sweet thing, she's going to let you pet that and have a
Yeah,
wonderful experience. The next day, the same dog walked on the campus and she went up and pet the dog. And 63 years of something was gone because I got to the actual source of it and took it away.
yeah,
You can apply that to any number trauma, PTSD, um, complex PTSD, little T trauma, big T trauma creates a belief system that
yeah.
yourself will not live outside of that until we heal that thing.
Yeah, and that's interesting because I mean, it's all belief system stuff. So who and I see this in my office, and I could if you ask me, who are the patients that don't get results, Dr. Troy, that you recommend this care, who doesn't get results? And I could always say the ones that don't keep their appointments or don't listen to what we tell them to do.
Yeah.
But do you have that in your profession? I know you get great results. We've talked about it, but are there ones that you go, wow, if I could just get them to do this to get them to get the result I think they're capable of? Is there
There's
anything
really
that holds them back?
yeah, not it just doesn't happen very often, but it's because I'm able to do the preliminary work to make sure they're in the right space of readiness before we do hypnosis. So that's crucial. And I've gotten better at that over the years. So now I can make sure they're really ready before we do it. And that helps most of them all get results. But before I really figured that part out, there were some people who weren't totally ready.
Mhm.
So they might have a real solid belief that things don't work for them.
Right,
And if I was working on the thing they came to me for, instead of the belief that things don't work for them, it wouldn't work. Does
right,
that make
right.
sense? Because
Absolutely.
that underlying belief is where I would have to start. Now, I know that now, so I get tremendous results now more than I did my first year, which was still a great year, but I didn't know that then.
Right,
Now I do. So, that can be a block if someone has that kind of belief or they're just not ready.
right. Well, it could be if somebody's like, "Hey, I wanna lose weight," or, "I wanna get rid of my pain," but yet they've got some sort of belief program that's it's not about losing weight or
Right.
pain, it's some other belief system that's overriding their whole existence, and pain is just a symptom of that,
That's
if you will.
exactly it. That's
Yeah,
exactly it. So in my first half of the session when I'm talking and asking questions, I have to get to every part that's contributing to this and do the first time the thing that's going to do the most good and calm that down. Then they're ready for more. Because there can be lots of different, belief systems that we have to get out of the way. And there's one other thing I would say about that. No matter what someone's coming for, what they often do, this is really good for anyone, is they shut off contact with the part of themselves and they judge it. So let's take a chronic overeater or something. There's a part of them that wants to eat all the pizza they wants to eat all the ice cream. There's a part of them that wants to, for the rest of their life, do that.
Yeah.
Right. And what they're trying to do before they come to me is like exile that person. But that
Right.
never works. That doesn't what has to happen is we need to take that part of themselves and go, all right, I hear you. You want to be completely sovereign. You want to make your own decisions. You get to. But let me just take a minute. Imagine if you could have pizza and not feel the way you feel.
Right. Right.
Would you want that? Well, yeah, you have to bring them into the committee, not
Yeah. Yeah.
exile them.
Right. Yeah. That makes sense. Yeah, we've talked about ice cream and how addicting that is. It's like, okay, maybe once a month and you reward yourself with a really good ice cream and you enjoy it and not eat
Yeah.
the whole tub of ice cream at night, for example. So that's kind
Yes,
of a fun conversation. But it's the same pattern, whether it's ice cream or pizza or
it is.
nicotine or alcohol or whatever, whatever
Yeah.
we're into. Shopping could be a shopping addiction, if you will.
It is, and that's why it's so fun to study the patterns of how people get stuck because they apply to all of them just with different nuances.
Yeah, that's why that's so fascinating to me. It's like, oh, we could do this and do that. And just, it's like building a puzzle,
It's
creating
endlessly interesting,
Yeah, it's like creating that cool art on your back wall there.
right?
That's what it reminds me of. So who are the people? So if there was one thing you could tell our listeners to really make the shift, I love that word that you use, make the shift. If there was one thing you could tell people whether they're addicted to pizza or ice cream or whatever, or they have chronic pain, what's one thing they could do? They could walk away today and go, I can start doing this, and that's going to help me move in the right direction.
Yeah, great. Okay. This I want to have them assess their readiness because when someone's ready, I can tell them exactly when they'll know they're ready. And if that's a yes for them, then I'll tell them what's the next second thing. So I'm going to make this two part. That's okay.
Okay. Yeah.
When someone is truly ready to change, it looks like this. And I learned this from Mike Collins. I'll give him credit. They're more afraid of not changing than they're afraid of the change. That's when they're really ready. So
Yeah.
if you want to lose weight and you're so afraid that you're not going to again, more afraid than actually making the change to make it happen, you are ready. And
Yeah.
once you're ready, it's not impossible and it's not even that hard if you have the right support. And I'll tell them why. Once you are ready, you ask yourself this question. Am I willing to do every single thing in my power to change that? And if the answer is yes, then it's actually not hard with someone like me working with them because if that's true, then all we will do together is figure out every way that it would fall down
Hmm.
and take that away, create a system for that not to happen. And then on a conscious level, they'll have a whole plan in place that when I always do this thing that always takes me down, I'm going to put this in place and that should do it. And then I'm going to use hypnosis because what hypnosis does is that puts all of that into their subconscious. So their subconscious knows it wants that way more than it wants to not do it.
Hmm.
So it's going to signal them, remember, we're going to do this when that happens. And it actually helps them work the system so that they do the thing. So
Yeah.
once they're ready to that level, it's not hard. They need, in my opinion, hypnosis and to just I call them put the pillows in place so that you can't fall down.
Right. Right.
Does that answer
Yeah,
your
I
question?
mean, yeah, no, absolutely. I'd agree with you because when I came to see you first time, I'm like, I'm ready. I got to make a change. I'm just, help me out. I was like, I'm surrender. And I do that with patients too. I'm like, are you committed to getting better? And if they
Yes.
say yes, I go, great, good patient. If they're like, well, I'm like, oh man, we got some work to do. Or I don't know if I
Yeah,
can help you if you're not committed,
that's right.
So
Yeah. And
what kind of, oh, go ahead.
that would just be a good question to ask them. Do you want this change? Are you afraid not to have this change more than you are afraid to change?
Yeah, no, absolutely. What kind of successes have you seen over the years? I mean, just tell our listeners whether it's back pain or other things.
Yeah. Okay. So many. I mean, it's so fun. I'll try.
Maybe give us your top couple.
Okay. Top couple. A gal in Florida she was a volleyball player. She was a very good volleyball player. and she had had an injury, but she'd recovered from the injury. But ever since then, she wasn't playing well because her subconscious was keeping her
Yeah.
safe.
Yeah.
So I worked with her. She started playing far better than she was playing even before the injury, and she got a full ride Division I scholarship, which was her dream. Just got a new that was 2.5 years ago, and I just got a new client in some state that knew her dad, and he's still talking about it, and I just got a new client out of that one, so that was a fun one. The phantom pain guy,
Yeah.
44
That's amazing.
44 years of pain gone. It was amazing. And then, I can't even imagine. I can't believe this one. I had a guy that was stuttering for 29 years who stopped stuttering.
Yeah. I think you
That
told
was
me that
amazing.
one, but that's amazing.
Yeah. And then I had my first client ever, who was my father-in-law, because he's
Yeah.
like, "I'll
Okay.
try
Now,
you
now you're going to get into my good stuff here.
out." Right? I know. We're still working on it with you. We're closer. He said, "I want to be more present and I want to improve my golf game." And I think they're related. We did one session. He left my office, went to the golf course, and golfed a hole in one.
Well, that makes me keep coming back to you. I want my hole in one.
I know. I know. We are
But
getting
no,
closer.
seriously, while we're on that fun subject, our listeners always go, "He loves golf," and I always throw a little golf in at the end. But that's one thing we've been talking about is visualizing that ball going in the hole, and it's whatever you want in life, whether it's golf or a better heart function or lower body weight, lower blood pressure,
Yeah.
whatever. You can do it all with the. I call it the monkey mind because that little guy is just always on the treadmill, and
Yeah.
you've helped me calm that thing down. So you can let the subconscious do what you're supposed to do.
Yes.
Any tips for our golfers?
Yes. And I'll piggyback on your visualization piece because visualization is a dramatically helpful technique, but I want to tweak it for what people might be thinking. It's not only visualizing it, it is also feeling the
Mhm,
feeling that you love about it, because that's sending a message that this is what I want to feel. So when you're visualizing, it's not just about the imaging, it's about the way it makes your body flood with the feelings you want to feel as well. So you're getting a full experience of it. It's just like if I've got someone with anxiety, I get them in hypnosis to a very calm state in the body, and then I'm basically proving to their body that this state exists in them, and then I call it their default mode now. This
mhm.
can become your default mode, and I have a great deal of success with anxiety for that reason. So, and the reason is because when you're putting yourself in everything that you love about it, you're sending a signal that this is what I'm meant for, what I'm here for. If I'm going to be alive, I'm here for this reason.
Mhm,
And we're all energy, and it's not woo woo to know that life is energy that does respond to the energy that you give. That's scientifically getting more and more and more close to being absolutely proven. But people who use visualization and have it come true in those ways have already proven it to themselves. They don't need science to catch up.
well, when you talk about anxiety, and I'll go back to golf, but I've read some mental type golf coaching, and they always say if you have anxiety or some sort of bad thought, it creates tension in the body, and golf doesn't like tension. Same thing with
Yeah,
anything, but you're going to hit bad shots when there's tension, when your cortisol's high, when you're not relaxed.
that's
So
right.
I think that part, like I always go out and play golf, and I'm like, man, I love the grass. I like walking, and when my mind's not on that, then I hit bad shots. Even if I hit bad shots, and I'm like, "Man, I love being out here. The sun's out or whatever. Look at the ducks, and I'm relaxed. I feel like I'm playing better golf when I do
Yeah,
that.
absolutely. And then you look for ways to reduce that tension if it's there. And one of them that a lot of people have is that this means something about me. So they'll feel like it's something about me personally if I do well or not well. That's not true. And if we can remove that illusion of a belief that, oh, wait a minute, I've just done inventory on my whole life. There's a million things I love about it. And I happen to also love golf. When they take their meaning away from being tied to how I do in golf, then it reduces the tension. And I do that with athletes a lot, because even if they're super high level, it's better for them to not have their soul identity attached to it. That makes them a
Yeah,
better player, actually.
yeah, yeah. So we always say focus on the process, not the outcome. Get your process down.
Exactly.
The outcome will take care of itself if you got a dialed in process and everything's in order. That's how I could
Absolutely.
I could proclaim that one. Is there anything else that you'd like to share our listeners before I let you go today?
Yeah, I would. We have tremendous potential and power inside of us to shift our lives, to move our ships in the direction of our dreams. And if you don't feel like an expert at that, that's because none of us were taught that super important stuff in school. It's not your fault if you're not an expert at that. Find someone who is, and they can help you literally make your own dreams and desires come true and then learn how to do it yourself. We
Yeah.
all have, everyone has the ability. And if you don't feel strong in that, come see me. It will not take long, or someone like me, to help you find out how to activate the power that already lives inside of you.
Yeah. No, that's I mean, that's huge. I mean, I've been studying this stuff for a long time, being a peak performer, and you know, when people get off track, even if you think you're Superman, you get off track and you need help,
Yep,
you know? So, I mean,
absolutely.
I remember the day I came in, I said, "Hey, I'm out of AFib," and you were just like, "Woohoo!" And you know, because we've
Oh,
been working hard at it, you and
I
me, you
know.
know.
I'll
So it's
never
kind of
forget it.
yeah, it's cool. It's cool. So I mean, there's another testimonial, but I can't say thank you enough. But it was fun chatting with you, and I mean, we could probably spend all day talking about stuff and sharing that.
Yeah,
So maybe we
this has
have to do
been
another show. So,
it's a
well,
pleasure, and I love working with you. I'm so excited for your results that you're continuing to get, and thanks for having me on.
all right. Thanks, Sheila. I appreciate your time, and I'll see you soon. So thanks everybody for listening. It's Dr. Troy, and thank you, Sheila from Shift Hypnosis. Her contact information will be in the show notes. If you want to reach out to her, feel free. Uh, we'll look forward to seeing you on the next show. Dr. Troy here. See you later.